Hey guys, Dr. Stafford here at Equilibrium Chiropractic in Greensboro, North Carolina. Again, I'd like to showcase another patient today, Dr. Andrew Savaris. How are you doing today?
I'm doing much better now, Dr. Stafford.
Well, I appreciate it.
I am. So I was involved in a car accident about a month and a half ago now, and I had seen Dr. Stafford's ad at the local Harris Teeter grocery store, and the grocery carts. I think it was a genius advertising campaign.
I appreciate that.
And we've grown up in this area, so I actually went to high school with Dr. Stafford.
There you are. That's correct.
So that's when I saw that fellow. Hey, I know that guy. Kept in the back of my mind, and when I actually needed chiropractic attention, I knew who to ask.
Well, very good.
And I had a lot of stiffness, especially on the left side of my neck. That was the doc's expert opinion said it was whiplash, and I felt it radiating even into my arm, and even my talked about I just wasn't feeling right alignment. But doc's care and attention, I've noticed a huge, tremendous improvement in mobility and just comfort of going through my day-to-day life.
So. Wonderful, wonderful. That's one of the things that he did come into us for. I think, like you said, your main complaints at that time, you had a little bit of a headache.
Yeah, a little bit.
Which is common, especially after a whiplash syndrome. And then the radiating pain, you had that dural sleeves in the nerve. As far as the nerves were stretched, okay, and that's with that quick flexion and extension injury. So a lot of what we've been doing here care-wise is, of course, we wanted to reduce muscle inflammation, and getting that one to calm down. We use other modalities to help with us being able to treat, Mr. or Dr. Savaris. And as far as care-wise, how do you feel overall with your care from when you first started to where you are now?
I remember we did all these assessments at the beginning, and I remember, and I can just remember even before that, I remember struggling to turn especially my head this direction.
Yeah, your range of motion.
And range of motion was significantly diminished, and now I feel normal.
Okay.
Feel normal, but I'm also more consciously aware of my posture. That's the thing. This wasn't just addressing the problems I had as a result of the accident. It was just kind of helping me reassess my whole life. And the body scan thing was also very helpful.
Oh, that's
too.
right.
I love that service. That was, if you want to learn more about yourself than you ever learned before, come in here for the body scan.
It's phenomenal tool.
It is.
I forget to even mention that. But again, whole body treatment package with it.
Yeah,
so.
Absolutely.
All right, so are you ready to get treated today?
I am ready,
okay.
Yes.
All right, we'll go ahead and have you lay down on your stomach.
Okay.
How's your lower back feeling today? I know that's...
Yeah, I had, when this first came in here, I felt a little bit discomfort there, but it feels pretty loose and normal now, I would say.
And that's one thing, again, his lower back wasn't his primary complaint or even like a secondary or tertiary complaint. And again, we really focused most of our attention on the cervical spine, cervical region, upper thoracic region, as well as kind of more of the neurological complaints with the headaches. But the headaches kind of dissipated after about 2 or 3 treatments.
Right. It's just amazing to me. You don't think about it, but the back is just the foundation for other problems in your body. And
That's right.
If you can address that, you address those problems as well.
That's right. Kind of like what Hippocrates says, right?
Absolutely.
Look to the spine for the cause of disease.
Well, a historian's going to go with Hippocrates.
All right, keep that leg straight. Raise it as high as you can off the table for me. Good. And then this left side. Good. All right, hip extension looks good. No pain or tenderness or tightness.
No.
Okay. So again, start off with some just mental adjusting in the mid-thoracic spine. More of a prone moves. Deep breath in. All the way out. Very good. Deep breath in. Drop those arms for me. All the way out. Very good. Deep breath in. Now, do you want me to do that prone adjust like what we did last time to really work on?
Oh yeah,
with the
curve. Yeah, absolutely.
All right, deep breath in. in. Very nice. How did that feel?
That was nice.
All right, put this left side up facing me first.
All right.
How's your water intake been?
Trying to watch it.
Okay.
It's something you have to be very conscious of. It's very easy to go.
Stay disciplined with,
yeah,
right?
It takes discipline.
It takes discipline. Hey, people get bored with water. They don't like the taste of water, which I never really understood. It doesn't taste like anything. Deep breath in, all the way out. Very nice.
Also, for me, it's just taking the time. Oh yeah, I need to drink.
That's right. Being reminded.
Yeah.
Because I'm sure when you get in the zone,
Exactly.
when you're doing your research.
Yep. No, it happens. You get in the zone. Hours go away. You're like, what just happened?
All right, deep breath in. All the way out. Very nice. All right, on your back. Let's just check your hip mobility. And great flexion. Lateral rotation, medial rotation's all really good. How are your ankles feeling today?
I'm feeling good. Feeling good.
Mm-hmm. Wonderful. Now, are we still exercising? I know you've been.
I've been slowly getting back into it. Yeah, absolutely.
Okay. Perfect. And what about cardio?
That's something I still need to work into the
Okay.
schedule.
Have you started it?
I'm doing some walks, but nothing more intensive than that.
Are you getting your heart rate up to about 50-60% heart rate max?
I mean, I know when I was working out the other day, I felt
I was there. Good. All right, so move around, see how you feel. Anything else that you would like me to focus on?
No, I've really noticed a positive change in my posture.
Good, and you're more conscientious about
I'm
your
more
posture as
conscientious,
well.
exactly, just going through day-to-day life.
Wonderful.
Yeah.
So if you were someone who was apprehensive about chiropractic, about individuals touching your spine as well as manipulating the spine, what would you kind of tell them just from your own personal experience?
Yeah, I would say that it seems intimidating.
All right.
But I mean, you've devoted your life to the spine, as we all should.
Yeah.
I'll tell you, is it something I think you don't think about too often, especially with our use of technology on a day-to-day basis. We're putting our bodies in positions that our bodies were just not meant to be in.
Right.
And you may be okay now in your younger, but as you progress, it's gonna have a domino effect. And again, not just for your back and neck pain and feeling, but through all the systems in your body, because all that nervous system is rooted there. So I would say that if the ancients identified this as a key to health and well-being, this is something that we in the modern world should not disregard. In fact, we should emphasize it more, I think.
I agree. Emphasize it more. So is that, in that regards, is this something you would continue from a maintenance perspective even after a release from care?
Absolutely.
Yeah.
I've seen a tremendous difference in, like I said, my posture and just general, and you don't realize how these things compound over the years, just from day-to-day life, not even accounting for an accident or something like that.
Right.
I know
initially what brought you in.
Right, exactly. And I know that was the right call, because I think back to what kind of position would I be in now doing the work I do, plus having loss of mobility and pain and stuff like that.
And most people, unfortunately, they just learn to live with it, and that becomes their new normal, even though that is not normal.
It doesn't have to be your normal.
It doesn't have to be your normal. All right, boss man.
Thanks, Doc.
You as well. All right, guys. From me, Flavor Chiropractic. Hope you have a great one.